Hi, it's Paul here again. Thanks very much for bearing with me. It's the fourth video out of the four that we're going to send you, and today we're just going to talk about some of the pros and cons. So vision correction is an incredibly safe procedure. If you add together people who have just vision correction for glasses and people having vision correction for cataracts across the UK, we do about 750,000 every year, and it's an incredibly safe operation. Hardly anybody gets any problems. However, things can happen. I'm not a perfect surgeon. I'm good, but no, I'm not perfect. If you meet a surgeon who says he's perfect, then you probably want to steer clear of him. I have about a 1 in 500 disaster rate, so things can happen. Black swans just happen to even the best. The procedure is incredibly safe, as I said, and it doesn't hurt. There's no pain. We use lots and lots of drops to numb things, so you can't feel anything. There's no needle, no scary things coming. You can't see anything horrible happening. You get quite a cool, swirly light show, but you can't work out what's going on, and it's not at all concerning. And when we do the procedure, often people are a bit nervous, but within a couple of minutes of us starting, you see everything relax. They realise, wow, this is not as bad as I thought. And the second time around, they're a piece of cake. So we need you off games next day, so the downtime is very low. You can the eye is not red afterwards, so you can work if you want to work from home, or you can do Zoom calls, but stay in the house next day, and that's pretty much all you've got to do. In terms of the implants, there's a few things to think about. The implants are very successful, and we will get you so that you can see well without glasses for about 99% of the day. For 1% of the day, you probably will need some form of glasses, either very fine print or for very far distance. But most people find that's pretty inconvenient, pretty minimal, and not very inconvenient at all. And the freedom from spectacles is something that's really, really wonderful. And you saw that with Helen. The multifocal implants will get you out of reading, intermediate and distance glasses for 99% of the day, but one hiccup they have is they occasionally can cause halos when you're driving at night. So someone does a lot of night driving will think, what are the pros and cons here? The depth implants, the ones that do distance and intermediate and near, so you have a slightly different one per left eye and right eye to give you 3D. They work very well, and you hardly ever get any halos. So if you're concerned about halos, we use them. But the chance of her needing reading glasses is a little bit higher for those guys who have those implants. And the third thing to think about is the toric implant. So when you have a toric correction, either with any of the implants we use will have a toric correction added to it in about 50% of the cases. Remember the eye I was showing you yesterday? Well, what it needs to have all three the curves all lined up. So you've got to line up the curves on the rugby ball here with the curves on the cornea here. And once in a blue moon, say once a year, once every 75, 100 cases, we line up the curves, and then sometimes the implant doesn't come out, but it's not aligned. I'm going to go back in and line it up again. So that's a very small procedure we do a week or so later if it's needed. So those are pros and cons of all the different types of implants. We talked you through how we do the procedure. You heard from Helen. It's worth listening to her again, and we can talk this all through when you see me in the flesh, when you come up to see me in the clinic shortly. So I look forward to seeing you then. See ya. Bye bye.